2 meters. So when those droplets or aerosol gets into your neighbor, then they get into the airway system. The larger ones will stick into the mouth or nose. And if it's a smaller one, it will go into the lungs. This is just, I'm not getting into all those details on the side. It's really not interesting for us for the purpose of this talk, but just bear in mind that those are the main 2 features that when we deal with, and that goes to prevention. And we'll speak on prevention just now. And that is, what measure should we perform to prevent us from being infected? Obviously, those prevention measures can be defined by the health system in your country. Still, we know that in countries that use masks on a daily basis, like Japan or East Asia, the rate of infection is lower. And the reason for that is just those 2 pictures. Assume yourself that you're being infected. You're just feeling well, and you're not aware that you can infect other people. The moment that you put a mask on yourself, you prevent the other people around you from being infected. And obviously that can be changed from the type of mask that you put on. And most people put surgical mask or just surgical cloth. And even those can give you some of protection. However, if you're a person who is walking around in the community and you put on yourself a mask, then you help yourself to prevent from being infected as well. It's not a foolproof, it just reduces the risk. And for that reason, masks are being used in Southeast Asia because they remember a lesson. The lesson is the Spanish flu from 100 years ago. We already spoke about that. Apparently, the community in Japan and Southeast Asia remember that, and masks became a habit since those days. Even nowadays, some countries suggest to their people to put masks. This suggestion is going to be a common suggestion in the USA, as the CDC, the Centers of Disease Control, is going to present that to the public. And even in Israel, here, there's a suggestion which is going to being adopted in the coming few days, that most people in the country should put surgical masks just to prevent themselves from being infected and to prevent the community for being infected from them if they are not aware that they are having the disease. Another interesting feature with this disease, and I find this really beautiful one, and you can find yourself looking at this, and on this side, the next strain site dealing with novel coronavirus, and we can see the epicenter of the epidemic over here. The pandemic started over here and then migrated. You can see that by the purple lines all around the globe. And when this epidemic reached a continent, then there was a genetic change in the virus. And for that, it is here presented by a different color. And those countries, continents, even transferred the virus to other continents and so forth and so on. And you can see the transfer of people by here and the genetic analysis of the virus over here. And you can see how it really delineates very nicely different countries, different colors, and change with time. And you can see this is the time scale from December up till now. Red is the United States, green is Europe, this nice purple is Asia, and the blue is Australia. One of the criticisms that were done on China is that it took China quite a bit of time to announce about this disease. This may be true, but numbers and dates does not really makes us being harsh on China. The first case that the Chinese found was initially in the 8th of December. By the end of December, they realized that they have a pandemic. The numbers presented over here is only 27 cases. I assume that in most Western countries, 27 cases of something wouldn't be noticed by anybody. Nevertheless, it was noticed by the Chinese, and the main criticism that probably that is being made on the Chinese, that probably by that time they had more than 27 cases. Nevertheless, on that time, they notified the WHO, and from that time until a diagnostics was made, only few days came. When we compare that to the last coronavirus epidemic back to 2002, 2013, over there, it took way longer for the same process of just less than a month to occur, and the global alert and notification of the WHO took from November to March. So in my view, although China may be criticized, we need to learn that China have learned from that SARS epidemic, and the process became way faster. So obviously, it's good that there were whistleblowers in Wuhan, in Hubei. Nevertheless, the process this time was way faster and way shorter. Just about the clinical presentation, we need to bear in mind, in most cases, the disease is extremely mild. 81% of the cases will have a mild disease. In 14%, additional 14%, it's going to be a severe disease, meaning patients are being admitted, maybe to the ICU, but not more than that. They will be able to recover. In only a fraction of those, only 5% of the cases will develop a critical disease that may lead to death, but not necessarily so. The death is also related to age, and it occurs mainly in the elderly population. And that reflects to some measure that being suggested for the elderly in an epidemic in this specific epidemic, the people who are older than 65 should stay at home and avoid from going to the public. That will save their lives and make them live happily after. The other population that is in risk is the healthcare personnel. The physicians and nurses are getting infected in most of the places around the globe. Some of the places is 4%, some of the places is higher, some of the places is lower. It's mainly related to how we, healthcare personnel, are protecting ourselves and keeping with the routine as is needed. We need to remember that. If we don't keep with the routine, we may end like in Wuhan, the epicenter of the epidemic, in which 63% of healthcare workers were infected by the coronavirus. If we go okay, like in Japan, none of us will be infected. The main organ that is being infected by the disease is the lungs, and here we can see CT scans of the chest, and those white areas of the lung are the infected area which disturb the ability of us human beings to breathe normally. This is the main issue that causes us to get sick out of the disease. And the moment the disease is going away, those white areas became those very nice black areas. The other thing that we need to remember, that we can, as human, if we are infected, can infect our peers quite early in the disease, even when we don't really have too much of infection. This is just one picture from the Lancet, but there's plenty of those. This is from a blog, a very nice blog that you can look after when a physician from Boston is trying to present or to give the data to the other people, to the community, to make them easy to understand. And I took it just today because it exemplifies very nicely the process of disease. Early in the onset, symptoms can be very mild. They may include some fever, sometimes chills or myalgia, but nothing more than that. Later on, some kind of GI complaints may occur, but a very mild loose stool can occur, but nothing more than that. And then nasal congestion, dyspnea, cough, sputum production occurs. And then generally is where we see the patients coming to us, physician. The days from which we are a bit more worried is the later day of the diseases. The early phase is relatively mild. The later days that occurs between day 7 and day 12 are the ones that one need to be very careful of. And those are the days in which probably a patient will need medical attention. Another article, another from the Lancet, suggested that those symptoms can last quite a bit of time. But the other thing that we need to remember, that if a person is infected, he can transmit the virus for up to almost 20 days, even when he got way better way before that. And if we summarize that in this cartoon, the early phase is just after we encounter the virus from a different person. Then we can be asymptomatic and non-infectious for up to 5 days, a median of 5 days. There's a range here, but the median time is 5 days. Then we might be symptomatic and then very mild symptomatic. And then only a certain proportion, a small proportion of the patient will get the severe disease. Most other people will have a very mild disease and will go through and then will recover from the disease. And even a smaller proportion of patients are dying. And the main reason for that is the burden on the medical system. The more people will be, the more difficult it will be to treat. And we need to remember the reason for that is because we as humans doesn't have any immunity for this virus. If we had immunity, then the whole picture of this epidemic will be completely different. So what about treatment? There's plenty of experimental protocols. They can include, as you have heard, the anti-malarial drugs, anti-HIV drugs, some very fancy and new drugs like the Gilead remdesivir or the Japanese favipiravir, and plenty of those are being mentioned. And there's anti-inflammatory, anti-immune, and very expensive drugs and very cheap drugs. But the most important thing, all of them are experimental protocols, nothing more than just that. And the data that we have to support this treatment is practically not good. We can excuse why we give a specific drug. We can excuse that chloroquine or antimalarials prevent the virus from getting into the cell of the human. We can claim that the anti-HIV drugs prevent the assembly of the virus like the other drugs. Nevertheless, most of it is not proved. It may be proved just on a cellular basis, on scientific manuscripts or papers, but in humans, most of those drugs was not proven to good extents. For that reason, we have other measures to take, and those are preventions. Unfortunately, vaccines are not available yet. Passive immunizations, like was done 100 years ago, when you take blood or serum from one patient who healed from the disease and give it to another one, isn't emerging and not being used at those days yet. And the most important thing that we can use is social distancing, hand washing, avoid the crowds, obey quarantine measures by the governments or health authorities. And I would add to that also put masks if you have those available. Just remember, if your medical staff around you doesn't have masks, avoid those, stay at home, give the mask to the medical staff. But if masks are available, use those. And the other thing which is extremely important, get information from the newspapers and health authorities that will help you to stay healthy. I would just try to end with few statements from the WHO. This is Dr. Bruce Ireland. He is the Assistant Director General for the WHO. And in his view, the most important measure that a country should take, and I don't want to get into any politics, it's just I'm quoting the WHO on this, you need to do a case isolation, you need to do it effectively and fast. You need to do contact tracking, you need to do it rigorously, and detection need to be done freely and in speed. I know in few countries, those are not being followed, but in countries in which those were followed, those are the countries that were the most effective in putting the disease down, putting the epidemiology down, preventing the spread, and making the ability of community to go into regular behavior as fast as they can. And that's just few of the things that should be done. Stop mass gathering, try not to isolate at home. Cases who are positive, according to the WHO, should be isolated at a special places like dorms or hotels, stadiums or whatever it is, that the approach that the Chinese took. And another measure that is being spoken all around is when you do a lockdown, when you do a quarantine, a mass quarantine, then you affect economics. And obviously economics is important, but it's all about the right perspective. You know, you can create a mass disease in a community, and then it will affect economics with time. And you can you can depress economics now, but after that enable the economics to go up quite fast afterwards, as we see in China those very days. So Dr. Tedros Adhanom Ghebreyesus, who is the chairman of the WHO, just stated this a couple of days ago, and I think it is a very important statement that I would like to quote to you. So he said that COVID-19, this disease that he spoke just about, is taking so much from us, but it's also giving us something special. It gives us the opportunity to come together as one humanity, to work together, to learn together, and to grow together. And we need to bear those items in mind, because those are the things that will make a difference and will enable both poor countries and well-developed countries to go out of this pandemic in health and with less damage as much as they can. I would thank you for your attention. If you like to follow me on Twitter, this is my Twitter. And this is just the Diamond Princess in Japan, for which I went to give some help to the Israeli patients that were taken out of this ship to the Japanese hospitals just a bit more than a month back. I would be happy to take any questions, and I wonder if there are any.
Yes, thank you very much, Dr. Nir Paz. About the questions, yes, I see raised hands, friends, but let's start first from the questions. Try to write your questions in chat, please, because we more than 50 people. We will start from the first question. Would you like me to read it, or you can read it from the chat?
So I will read it. So somebody apparently.
Let's start from the first one. The first one was Joey Wolf. It was the first question.
Oh, Joey Wolf. Just a second. I missed that. Yeah, sorry. Can you explain why, when Israel locked down very quickly, that the numbers affected and the death do not reflect their efforts? How can we understand when in our country, the UK, there's a very low level of testing? So there's two questions over here, and just about the Israeli lockdown. The Israeli lockdown was not that perfect, and apparently some of the Israeli were allowed to go out. Some of the communities in Israel were able to maintain their normal lives, like the ultra-Orthodox community, the Haredi community, continue to make their lives as usual. And what we see now in Israel is mainly a big surge in Haredi patients that were not following the orders. So when not the whole community is following the orders, you just get it back to you with patients being infected. And apparently that's the main issue now in Israel. And the only thing that I can say about the UK, that apparently from what I see, there's a flip-flop over there from doing testing and then avoiding testing, from looking for herd immunity and then understand that herd immunity will just make the country, the medical system in the country collapse. So I think that I read today somewhere that in the UK, they start to understand that they need to do a plenty lot of testing. And the only thing that I could say that probably the best will be just to follow the WHO. They reflect the experience from many countries, and the more you try to follow what they do, the better the community will benefit out of it. That's in my view. And then there's a question: if you've had the virus, should you still be social distancing? Oh, that's a nice question. So the answer for that is, if you had the virus and you were sick and you were cured from the virus and you don't have the virus, you don't spread the virus anymore from your nose and mouth, then probably you can go out and be nice to everybody, and you'll be the one to help everybody maintaining their normal lives, because you're probably immunized. You are probably immunized. But different countries have different measures to look at it. In countries in which there's hardly any testing, what they suggest that the person who was infected, after he got healthy, he should wait for 14 days and then go out. In other countries, there's a routine for searching for the virus, and only when the person is twice by PCR negative, he's declared cleared or healthy. And then there's a question over here. What is your opinion on the theory of former Israeli health chief, Professor Yoram Les, in that lockdown effect will kill more than the virus, and isolating all the elderly and those with underlying illnesses will be more effective? So this theory exists not just in Israel, but also in the UK. There was a very nice paper from the UK about how to do lockdowns and what is the most effective lockdown methodology. Different countries behave differently. Obviously, keeping the elderly at home and helping them at home is a very effective method, preventing the disease from the elderly, and it should be nice and should be working. Nevertheless, most of the countries does not doing such a very selective lockdowns. In many countries, the lockdowns are more robust, and we need to bear in mind that even younger people may be infected. And in fact, in our ICU today, half of the patients are people with the age of below 50, meaning even younger patients can get a severe disease. And for that reason, I think countries prefer to do a more robust lockouts. And then another question: is there any evidence as to the knock effect the virus is having on patients suffering from non-COVID-19 illness? Meaning, are more people during, I think, dying because resources and doctors are struggling to cope? The answer for that is yes, but only on specific countries. In Italy, that is the situation. Probably in other European countries, that is the situation. This is not the situation in Germany. In Germany, there's plenty of medical resources, and for that reason, Italian patients are being exported to Germany, and even Dutch patients are being exported to Germany because the Dutch system cannot handle the amount of patients. And then another question. More questions?
It was a question, Doctor, it was a question you missed about the P18. Question: is it possible that peptide P18 could be part of the treatment or inhibit spread? can you see this question?
No, I don't see this question.
From Andrew, okay, he asked me privately, sorry, okay. The question is this: I recently discovered and some article on the internet, and then the question is it possible peptide P18 could be part of the treatment or inhibit spread? Could you explain us what is peptide P18?
Unfortunately, I'm not aware of this idea of P18, and I don't really know what's PA18 is. So unfortunately, I cannot answer that.
Okay, we have more question there. In the UK, there is no testing after a head coronavirus to check you clear.
Okay, Belinda, yeah. In the UK, there is no testing after you had coronavirus to check if you are clear. The policy is after 7 days of the first getting symptoms, you are not contagious. Unfortunately, I cannot accept this thing because we know that there's a very large variability on the ability of spreading the virus. And the difference between few patients can be, few patients can spread the virus up to 4 weeks after having the disease. My best example is a couple of patients that I had in Japan. They were taken out of the ship. They were feeling healthy and happy. Nevertheless, they had to be locked in the hospital for 4 weeks because they were still spreading the virus for 4 consecutive weeks after they stopped to have any symptoms. For that reason, many countries suggest that the only way to go out of lockdown or isolation is just to have a negative test. I think that the main reason for a country to suggest a topic like this is just the issue of not having enough ability to test. And if you don't have enough ability to test, then you need to compromise on something. And for example, in Israel, there's a big debate about how much testing is being needed. The WHO has a ballpark that somewhere between 5% positive to 10% positive is the right number of testing that the country should have. But the Chinese went for way lower numbers. In China, 1% positive was good enough for testing, and that was the measure that they've used. Is there any evidence related to post-infectious chronic fatigue syndrome? So I would answer for that is we don't have enough data for that. Nevertheless, one of the main features, the initial features of the disease is fatigue. And quite a few patients will report fatigue to be the main symptom for this virus initially. So for that reason, I have no idea about post-infectious, but fatigue can be one of the symptoms of the disease. So P18, somebody is writing for us over here, Andrew, that P18 is a peptide made by Bacillus subtilis. Again, I'm not aware of any paper regarding P18 and this disease, so I cannot comment on that. And there's a guy here that suggests that a lot of people have lost sense of smell and taste and are not sure if they have the virus, as there is no testing in the UK. So we found quite often that changing in the sense of taste and smell may be just the sole presentation of the virus. So I would suggest that if you have a change in smelling or taste, and you live in a country which is infected or being hit by the pandemic, then this might be just a sign for you to know that you are infected. In such a case, I would just suggest that the person like this will consider himself as infected and will follow the routine of this country. If tests are being available and being proposed, then use them. And if not, just follow a ballpark of at least 14 days from the onset of symptoms and avoid the public at least for 14 days, if not more. And then another question is the risk of severe disease related to the dose or level of exposure that you may have encountered? So that's an interesting question. We don't have a good answer for that, but from what we know from the literature and from what we see in the hospital, the severity of disease is probably not related to the amount of virus that you've been exposed to. It's probably some kind of interaction between yourself and the virus that occurs with time. Again, some comment about the P18 of Bacillus subtilis. Again, I cannot comment about it. I never did. I didn't read any literature about it, so unfortunately, I cannot comment about that. More questions, guys.
Let's try raise hand. The people who I see, please try raise hand. Okay, Lev Atlas, please.
Hi. My question for some reason didn't get through. My question is, how would the fact that virus genetically changes affect the prospect of developing vaccine?
So that's a nice question. We don't know for sure the answer for that, but those changes are very mild as far as we know. They are being anticipated from such a virus which is an RNA virus. You anticipate those changes to occur, but it seems that some major parts are still conserved, and that's from one part. The other part that we need to bear in mind, coronaviruses might be tricky for vaccines. So we hope that these not make a big difference.
Okay, thanks.
Yitzhak?
Yes, how do you see the future or the progress of the virus here in the UK, as there are no checks, no tests, and they don't know, nobody knows how many people here are infected, actually. So what's going on here? What's the future?
So I would say to you that the way to go is just look at the number of people who succumb to this disease and calculate, extrapolate from that the number who are being infected. That what might be the way to look at it. So if I remember correctly, there's about 2,000 people who have died in the UK. Then just multiply that in the number of about 50 or even more, 100, and you can guess what is the right number in the UK right now and extrapolate from that. Fortunately, I'm not a UK resident, so nobody will punish me for saying that, but that's about the numbers that one should approximately suggest. We have few physicists here working on modeling, and apparently those numbers fit into the models, and if we extrapolate from those numbers, you can predict that the number of positive cases in the UK will be something like the number of people who have died, including the number of people in the ICU, multiply that by 100, and that will give you a very nice, rough, but a good estimate about the number of cases.
Jonathan Taylor? I'm trying.
Can you hear me?
Yeah, please, Jonathan.
Yes, in this country, they still haven't done any testing because they're claiming that the proper tests haven't been validated, and therefore the tests which have been used in all the other countries seem to be inferior or not good enough. Would you say that's true? Is that the reason for them delaying so long in making tests available here?
Sounds like you live in Israel.
Well, I'm involved in this market here. I'm meant to be supplying some tests to the NHS, and they're taking a long time making decisions.
So I'll tell you something about it. Apparently, when a country doesn't want to that's just an observation, you know. But that occurred in the USA. And this is also occurring in Israel to less extent because there's a lot of pressure for testing from the medical community and scientific community. Apparently that's the case in the UK. I would quote on that from the director for epidemics in the WHO. He has a quote that suggests that your enemy to fight the disease is perfection. If you look for perfection, you're gonna lose. That's a statement from the pandemic director in the WHO. What does it mean? It means that you need to do what you have at hand and then try while working, make it better. But if you start claiming it's not working good, it just, you know, have a negative predictive value of or false positive rate of 2%, it's not good enough, and false negative percent of 2%, it's not good enough. That's what you have, and that's what you need to play with. In Hebrew, we have a saying, for those of you who understand Hebrew, it's a slang. It says that זה מה יש ועם זה ננצח. For those of you who understand Hebrew, you need to play with what you have at hand and use it to the best of, or to the benefit of the community. Just playing with this is not good enough is not going to work for you.
So they've wasted opportunities then here, have they? You're saying? They've wasted a lot of time.
Yeah, for sure. But I would say one thing more. If the assays that you're trying to offer are serology, then those are not good for such an epidemic. Serology will play a role just later on when you want to put people back into work and you want to screen a large set of community, then those will play a role. So the most important tests at this stage are the genetic test. And we can take a very nice example from few countries. For example, in Korea, when they started that's going to be a problem, they supported the industry for developing genetic tests. And they enabled the industry to come out with 4 or 5 genetic tests. And the one that came was supported by the government, and then another came, and then another came, and then another came. And that just enabled to build up the capacity in Korea. The same was true in China, and to some extent they understood that in few of the cases, CT imaging is the best way to go, and that's what they've done. They went with CT imaging. You need to move fast, and you need to use whatever you have. And if you ignore whatever you have, then you're going to lose. And this is not my quote. This is quoting the WHO, which is fairly easy to quote. And there's few questions here. Plenty of.
Yes. Few questions in the chat, please. Thank you.
Yeah. There has been a wide difference of opinion about the value of masks, but you are now advocating their use. Thank you very much for a very helpful, informative presentation. And yes, I've read that just earlier today that they announced a big increase on the testing in the UK, and that is very important for really controlling a disease and mitigating it. And then another question, is earliest intervention with CPAP or ventilation machine likely to diminish the risk of irreversible damage to your organs? So that's kind of interesting. What we know about ventilatory support in those patients is not necessarily CPAP, but a methodology called high frequency non-invasive ventilation, or AIRVO. One of the machines is made by a New Zealand company called Fisher-Paykel. If you really have a fancy house, you might have a Fisher-Paykel refrigerator or washing machine. But this company is also making a very nice respirator. And apparently those machines are very useful for the early, for people who got complications of the disease. It can prevent in some of the people being intubated, putting a tube into the throat and ventilating them with a ventilatory machine. And then another person asking, how long do you think this is going to last? I'm not, I think, have any genes of prophecy. So it's really hard to answer on that. There's a couple of models. One suggested it's going to go down in summertime and then go up next winter. And there's another model suggesting that this disease is going to burn and burn and burn until we'll be able to mitigate it very effectively. Initially, people suggested that there's not much disease in the southern hemisphere, and that's the reason that in summertime it's going to go away. But since then, disease was rising in the southern hemisphere, and for that reason, we cannot say anything about the summer based on that. Do you think that taking vitamin C will protect from catching the virus? We have no evidence to suggest that. I would say that oranges, lemons, and grapefruits are really great sources of vitamin C. Enjoy them, but not for the vitamin C, but just for your enjoyment. And obviously vitamin C is important, but not necessarily for this disease. Okay. Latest excuse in the UK is lack of testing, lack of reagents, or logistics failure. The other part of this question is really, really important. Apparently, the whole world is lacking reagents and logistics. We need to remember that. Countries are fighting for reagents, protective wear, masks, ventilatory machines, and the pricing of those are really skyrocketing, and many of the companies are not working to manufacture those. And for that reason, it's not an excuse, but a real fact that it's really hard to find those resources. So it's difficult. And then another question, how do we know if countries are giving accurate data? I'd say that we know that countries are not giving accurate data. So you need to find out of the data they give what the truth is. Some countries are really giving nice data. Some countries are just giving whatever they have at hand. And we assume that some countries just doesn't tell the whole truth or just part of the truth. So that's for the epidemiologists to understand how things are going. And we need to bear in mind that in some countries, there's no good testing methodology, so we don't have a good data from those countries. We were planning to come to Israel in August for 2 weddings. Mazal tov for that. In your opinion, do you think that these are likely to go ahead? I have to say, I don't even think about Leila Seder, which is next week. So I think predicting for August is way too far away, and we don't really know what's going to be in August. Time will tell. What role does the antibody test have to play? So antibody tests are tests that are being performed taking blood from a patient, and you test for immunological response for the virus. We know from what we have from China that only 70% of the patients who had the disease really get antibodies. And with that in mind, we know that antibodies won't be able to let us know all the people who were infected. Nevertheless, they will help us know when we screen people to know if they have antibodies, then they can work with infected people or start going back to work as normal. So they will enable us to go back into the routine, at least in certain populations. Number of deaths are very frightening, but can you give us an idea how many deaths happen in 24 hours without a pandemic? So that's depend on the country, and I cannot comment for the UK. I hardly can comment on that on Israel. What we suggest about those numbers, that those numbers are excess to the regular death numbers in a country, still in small countries, when you have a low number of deaths, you can't really suggest that those are really excess to the regular. We'll be able to know that the number of death within a country only later on, when the whole numbers being accumulated. And then a question: ultraviolet light kills most pathogens. Can we expect the same with COVID-19? So the most important thing to kill COVID-19 is just wash your hand with soap. Water and soap will do the work, or the alcohol, 70% alcohol gel that you can purchase in the pharmacy are really good measures to prevent being infected from the virus. Those are the easiest to use. And somebody is commenting over here about the death rate in the UK. Normal death rate is a bit less than 10,000 per year. What about outside environment and sunlight? So we generally assume that if you walk alone in the park, you are safe. That's a fairly first statement to say. We know probably that UV light can kill a virus, but it's, from what I remember about disinfecting with the virus, it's not one of the methodologies that are being implemented. There's other methodologies that are being implemented, and in fact, the most effective is indeed just wash your hands and use alcohol, 70% alcohol. We need to remember there's an article, I don't want to get into that, about in what surfaces the virus will survive, but it's too complicated to deal, and practically speaking, in most cases, we don't get infected in the community unless we were in extremely close contact with a person, or touched hand with the person, hugged, or things like this. So the current recommendation in those days, if you were in a close contact with a patient, COVID-19 patient, but less than 15 minutes, or with a distance larger than 2 meters, then you're fairly safe. And then there's another question: when should you call a hospital as critical? So I would suggest something that I've suggested to somebody I know. If you have COVID-19 and you want to be safe, just try to get a pulse meter, an oximeter. Use it as a good measure. If your saturation is above 94, you're in safe grounds. If your saturation is below 90, you need to go to the hospital. If you're in between, it's all about how you feel. That's the best suggestion if the medical system doesn't give you a close medical admission when you're being infected, or a close watch, or a close follow-up when you're being infected.
Any more questions, please? And I think if not, we will thank the Professor Nir Paz. How long before the vacation? Okay.
How long what before the vacation?
Vaccination.
Okay. Again, this is a tough question. I would assume that it would be fair to estimate that vaccination will be available only a year from now. That's a fair assumption. We can hope and pray that it will be faster than that, but most authorities assume that vaccination will be available only within a year or so.
Ladies and gentlemen, we will finish this meeting now. Just a couple of words. Thank you very much, Professor Nir Paz, for your time. It's really appreciated in these not simple times. The second thing I would like to thank you to World Zionist Organization in Israel and the UK. And last but not least, our next session with the e-lectures, what we're representing in the UK, will be on Sunday, 7:30. The lecture will be with Gil Chovav, Israeli chef and writer, from lentil soup to shakshuka. Please join us. You have find more information on World Zionist Organization UK Facebook page. You're welcome to join. Thank you very much. Stay safe and have a good night. Thank you.
Good night.
Good night. Thank you very much.
Thank you very much.
Okay.
Thank you.
Thank you very much. כל פעם.
Leave. Very interesting.
Дэн, что ты делаешь?
Чтобы следующее день рождения мы все, 31 осталось семейства, справляли вот тут вот сзади, там где, видишь, на Карибских островах. Желательно в каком-нибудь своем резорте. Ты нас всех пригласишь. Если вроде какой золотой, то мы туда где-то пойдем уже.
Сейчас, когда все скажут, потом наша будет опять очень.
Нет, может с колесами. Я на остров с колесами, нормально. Все в порядке. Если в рыбе золотой прилетит, то все будет хорошо. Спасибо. Вы правильный джок объяснить? Вернее, ой, я честно.
А где это? Дай, пожалуйста.
Ну, вкусная технология, она вот такая, видите? Невидимый человек. Мы очень любим и поздравляем тебя, как бы ты перерос 42, смысл жизни ты уже как бы оценил. Теперь ты быстрыми шагами двигаешься в Изор, в район туризма. Да, а группа риска, знаешь, в чем заключается? Потому что когда смысл жизни уже оценил, теперь начинаешь его расценивать обратно. И это самое опасное. Забираться наверх легче, чем спускаться вниз.